Hello and welcome to Chapter 19 lecture, Assisting in Orthopedic Medicine. Here are our learning objectives: to define, spell, and pronounce the terms listed in the vocabulary, describe the principal anatomic structures of the musculoskeletal system and their functions, differentiate among tendons, bursae, and ligaments, summarize the major muscular disorders, identify and describe the common types of fractures. Explain the difference between osteomalacia and osteoporosis. Classify typical spinal column disorders. So the general functions of the musculoskeletal system is to protect the internal organs. It supports the body in standing erect, and it produces the movement. It also stores the minerals, calcium, and phosphorus in the bone. And it also performs the hemopoietic functions, which is the production of blood cells in the red bone marrow. So I know that you have already taken anatomy physiology, so this is a review for you, the next several slides, but just want to kind of review your mind with this. Anatomy and physiology of the musculoskeletal system. There are more than 600 muscles in the human skeleton and more than 200 bones. The musculoskeletal system includes all skeletal muscles, bones, joints, and the supportive connective tissue. Here we see the muscles in the body, and B is the posterior view. Okay, so we have anterior, posterior. And here are the types of muscle tissues. We have over here, I can show you here. This is the skeletal muscle. This is smooth muscle. And this is cardiac muscle. We have the image of the human skeleton. This can be found in figure 19.3 in your book. So the bones provide a framework that protect our vital organs. And the human skeleton is composed of more than 200 bones. The structure of the bones here, you can find this in figure 19.4. Bones generally are categorized by the shape, so long, short, flat, rounded, or irregular. And here in figure 19.5, this shows the sagittal section of the knee joint. And you can also find this in the book if you want to look at it more closely. There are two main kinds of joints. There's the non-synovial joints, and the bones are joined with fibrous cartilage, and the joints are immovable or only slightly movable. So slightly movable example would be a vertebrae, non-movable would be the sutures of the skull. And then there are synovial joints. And the synovial joints are freely movable because the adjacent ends of the two bones are covered with cartilage, are enclosed in a joint cavity that contains viscous slippery fluid called the synovial fluid, which is an excellent lubricant. So types of joints, there are suture joints that have limited flexibility, like in the skull. There are hinge joints which allow movement in one place, like the elbow or the knee. There are gliding joints that are made up of two flat surface bones that slide over each other. You can see this in the wrist. And ball and socket joints. This allows the joint to rotate in a circle, like in your shoulder or your hip. One wonderful thing is that we now have artificial joints that have been successfully implanted to replace joints that have been damaged by disease or trauma, including the joints of the hip, the knee, ankle, shoulder, elbow, wrist, and finger. So ligaments, tendons, and bursae. Ligaments are powerful, strong, fibrous band of connective tissue that connects bones and bone at the joint and encase joint capsules. Tendons are strong bundles of connective tissue that attach the muscle to the bone, and bursae are the fibrous sacs that lie between the tendons and the bones, and they are lined with synovial membrane that secrete synovial fluid and act as cushions. Ligaments allow purposeful joint movement, and they prevent excessive movement in any particular joint. And plantar fasciitis, have you heard of that? This is the most common cause of heel pain, and this would be a disorder of the joint. Musculoskeletal diseases and disorders can affect any of the muscle, bones, or joints. Trauma can lead to inflammation in areas of injury, and we use RICE therapy, which is rest, ice, compression, and elevation on the injured area. Diet should include food rich in calcium and vitamin D. We educate patient to avoid smoking and to do specific weight-bearing exercises. What do you think one of the leading causes of time lost from work and for visits to providers and emergency departments are? So let me ask you that again. What is one of the leading causes of time lost from work and for visits to providers and emergency departments? If you thought trauma to the musculoskeletal system, you are correct. So a little trick also is you can use a bag of peas, like frozen peas, to ice an injury, and it works very well because the peas are all little inside, so it's movable and it can kind of form to the area of the injury. Here are some musculoskeletal diseases and disorders, and we have talked about several of these actually during pharmacology, and I'm sure that you probably also discussed them in your anatomy physiology, but we'll just go over a few interesting things. So we have fibromyalgia, myasthenia gravis, sprains and strains, muscle spasms, restless leg syndrome, fractures, and there is a table 19.3 that I want you to look in your book more closely at the different types of fractures, and osteomalacia. On the next slides we'll talk about some more, but I just wanted to focus on these very briefly. So for fibromyalgia, the treatment goals for fibromyalgia are to include reducing pain, enhancing sleep, and reducing anxiety and stress. And spontaneous improvement and remission can occur with fibromyalgia. So it can kind of almost not magically, but with treatment and things, it can go into remission and you can not see the symptoms when you had been previously seeing a lot of symptoms. So also, we talked a lot about myasthenia gravis just recently in our lectures. I shared with you that my aunt has it, that the voluntary muscles are affected. And so I'm not going to go over that one too much. With sprains and strains, treatments include RICE, rest of the injured joint with no weight bearing to prevent further damage, cold application for 20 minutes at a time, 4 to 8 times a day during the first 24 to 48 hours to reduce pain and swelling. And this is something that I'm sure that you will educate patients on quite often in most offices that you're in because they link to the musculoskeletal. So again, the RICE, we talked about it in the last slide, is rest of the injured joint with no weight bearing to prevent further damage, a cold application for 20 minutes at a time, 4 to 8 times a day during the first 24 to 48 hours to reduce pain and swelling. Compression with an elastic wrap or air cast to reduce the swelling, and elevation in the injured part. So you want to make sure whatever part is injured is elevated. Looking at muscle spasms, the treatment for muscle spasms include massage, direct pressure, ultrasound therapy, stress reduction, stretching exercises, and muscle relaxants in some cases. Osteomalacia is the softening of bones due to the lack of calcium or phosphorus to build a new bone. And then looking at fractures, again, I want you to go back and look at table 19.3 and look at that information in your book. With fractures, a lot of time casting is involved. Here is an example of an ankle sprain. And you can see that inflammation here. And that can also be seen in figure 19.6. And an ankle sprain is probably the most common sprain to occur in the offices that we see. So osteoporosis, different than osteomalacia. Osteoporosis is a disease in which the calcium deposits in the bone gradually decline. Bones become increasingly weak and brittle, such that even small stressors can cause fractures. And as we age, the remodeling breaks down the bone more quickly than it can form a new bone. Osteopenia is a mild bone loss that increases the risk of osteoporosis. By the time the fractures occur, this disease is quite advanced. People over the age of 50 are particularly at risk, and women are 4 times more likely to develop osteoporosis than men. Osteoporosis is a major public health threat in the United States. It affects more than 40 million individuals. Let's look at some risk factors and diagnosis. So risk factors include being female, over 50, slight build, family history, history of amenorrhea, low calcium intake, excessive caffeinated soda intake, inactivity, smoking, alcohol abuse, hyperthyroidism, reduced exposure to estrogen, and certain medications. This is diagnosed by a special form of an X-ray, and treatment is to increase calcium and vitamin D, to do certain exercise, and treat with medications. The National Osteoporosis Foundation recommends that all women have a bone density test if they are not receiving estrogen replacement therapy, and if they are in some of these categories or any of the following categories: undergoing long-term treatment with medications that can cause osteoporosis, such as prednisone, have diabetes type 1, liver disease, kidney disease, or family history, and if they've experienced early menopause in their early 40s. Look at the spine here. So when the spine is viewed from a lateral position, you can see that there are 4 normal curves. What is scoliosis? I'm sure you guys have all heard of scoliosis, and you probably were screened for it in school. It's any abnormal deviation or curvature to the right or left. Okay, so that is what scoliosis is, and we're going to see some abnormal curvatures here. So there's hunchback curvature. See, the back goes out. Sway back, how it comes in. And this is actually the scoliosis coming down. You can see that it's not aligned correctly there. Treatment may include orthopedic devices such as braces, shoe lifts, exercises, and electronic muscle treatments, stimulation. And in severe cases, rigid casting with or without surgery may be necessary for abnormal spinal curvatures. You can find this image of a herniated disc in figure 1910 of your book. And a herniated disc occurs when the soft nucleus of an intervertebral disc protrudes through the tear or weakened area in its tough cartilaginous covering. Now look at the learning objectives for 19.2, the orthopedic disorders and treatment. Differentiate among the various joint disorders, summarize the medical assistant's role in assisting with orthopedic procedures, explain the common diagnostic procedures used in orthopedics, discuss the therapeutic modalities used in orthopedic medicine, and apply cold therapy to injury. Discuss various heat treatments and assist with hot moist heat application to an orthopedic injury. Discuss therapeutic ultrasonography, massage, exercise, and electrical muscle stimulation. Explain the use of common ambulatory devices, properly fit a patient with crutches, and coach the patient in the correct mechanics of crutch walking. Discuss the management of fractures and prepare and assist with the bone application and removal of cast.